Men, there are 5 everyday habits that could be quietly damaging your sexual health. And you might be doing at least one of them right now. These aren't rare mistakes that happen once in a lifetime. They're common, routine behaviors, the kind we don't think twice about, but over the years, they can lead to erectile dysfunction, hormonal imbalances, reduced sensitivity, and in some cases, permanent damage. The good news is that every single one of them is preventable, if you know what to look out for. Over the next 45 minutes, I'm going to walk you through exactly what these habits are, why they're harmful, and what science says you should be doing instead. We'll cover things like your choice of underwear, your sitting posture, how often you engage in solo activity, even the products you use during intimacy. And by the end, you'll have a clear, practical, science-backed plan for protecting your sexual health for years to come. Let's start with one of the most misunderstood topics in men's health: masturbation. There's a lot of confusion and, frankly, a lot of misinformation around this. You've probably heard everything from, "it ruins your performance," to "it's completely harmless, no matter how often you do it." The truth, as usual, is more nuanced. Large-scale research, including studies published in the Journal of Sexual Medicine, shows there's no direct link between masturbation alone and erectile dysfunction. In fact, in moderate amounts, it can have protective benefits for prostate health. The key word here is moderate. Where problems begin is when masturbation becomes compulsive, especially when combined with heavy pornography use. Porn delivers a level of stimulation that's far more intense and far less realistic than what the brain experiences during real intimacy. Over time, your brain adapts to this higher level of stimulation. This process is called neuroplasticity, and in this case it works against you. Your reward system begins to expect more extreme stimuli to reach the same level of arousal. As a result, real-life encounters might feel less satisfying, or may even fail to trigger the same excitement. Studies in JAMA Psychiatry have shown reduced brain reward activity in men who consume pornography frequently, meaning their brains have to work harder to feel aroused. The practical solution is simple in theory, though not always easy in practice. If you're watching pornography daily, especially in combination with multiple masturbation sessions, it's worth cutting back. A healthy range for most men is about 2 to 3 times per week, without relying on pornography. If quitting or reducing porn feels difficult, that's a sign it might be worth speaking to a therapist or healthcare provider who specializes in sexual health. They can help address not just the habit itself, but the underlying patterns that make it hard to change. Before we go further, if you find this kind of deep dive into practical, research-based health tips helpful, make sure you subscribe to this channel. It's the easiest way to make sure you don't miss future videos that can help you take better care of your body and your health. Now let's talk about something most men never think about: the products you use during intimacy. It might seem harmless to grab whatever's nearby, hand lotion, soap, even oils from the kitchen, but here's the problem. Many household lotions and cleansers contain chemicals like parabens and phthalates. These are known as endocrine disruptors, meaning they can interfere with testosterone levels, affect sperm quality, and disrupt your hormonal balance. Research published in Environmental Health Perspectives shows that repeated exposure to these chemicals can accumulate over time, especially through the thin, sensitive skin of the genital area. On top of that, using non-sexual products as lubricants can cause irritation, allergic reactions, and disrupt your skin's natural pH balance. The fix is straightforward. Always use a lubricant made specifically for sexual activity, ideally one that's paraben-free, phthalate-free, and glycerin-free. Water-based lubricants are safe with condoms and easy to clean, while silicone-based options last longer, but may not be compatible with silicone toys. Read the label. Buy from reputable brands. And remember, what goes on your skin matters just as much as what goes in your body. Here's something that surprises a lot of men: your underwear could be harming your reproductive health. A landmark study in human reproduction tracked over 650 men and found that those who wore tight briefs had a 25% lower sperm concentration and a 17% lower total sperm count than men who wore looser boxers. The reason is temperature. Sperm production requires a temperature slightly lower than the rest of your body. That's why the testicles hang outside the body cavity. Tight underwear pushes them closer to your body, raising their temperature and impairing both sperm and testosterone production. And it's not just tightness. Synthetic fabrics can be treated with chemicals that are absorbed more easily when your skin is warm and your pores are open, such as when you're sweating. Some fabric treatments have been shown to disrupt hormonal function. The solution is to choose breathable, natural fabrics like cotton or bamboo, and opt for a looser fit that allows airflow. Avoid chemically treated fabrics, especially anything labeled antimicrobial or stain-resistant, as these often use chemical coatings you don't want near sensitive tissue. Let's move on to something that affects millions of men every single day: prolonged sitting. If you have a desk job, commute long hours, or spend your evenings in front of a screen, this is especially relevant. Prolonged sitting isn't just bad for your back, it can increase your risk of erectile dysfunction. A study in the American Journal of Epidemiology found that men who sat for more than 6 hours a day had significantly higher rates of erectile problems compared to those who sat less than 3 hours a day. The reason is that sitting compresses blood vessels and nerves in the pelvic region, reducing blood flow and potentially affecting erectile function over time. It also contributes to metabolic syndrome, which is strongly linked to erectile dysfunction. The fix here is simple. Stand and move for at least 5 minutes every hour. If possible, use a standing desk for part of your day. Commit to at least 30 minutes of moderate exercise most days. It doesn't have to be the gym. Walking, cycling, or swimming all improve circulation and vascular health, which is directly tied to sexual performance. Next, let's talk about constriction rings, sometimes called penis rings. These can be safe when used correctly, but dangerous if misused. Leaving one on too long can cut off blood flow, causing swelling that makes removal impossible without medical help. In severe cases, it can lead to tissue damage, necrosis, and even amputation. Most manufacturer guidelines recommend using them for no more than 20 to 30 minutes at a time, and never falling asleep while wearing one. If you have heart disease, diabetes, or clotting disorders, speak to your doctor before using one at all. And never improvise with makeshift devices that aren't designed for safe, medical use. Finally, let's address anal intercourse from a medical perspective. It carries higher risks than vaginal intercourse because rectal tissue is thinner, less elastic, and more prone to microscopic tears. These tears can occur without pain and make it easier for infections, including HIV, to enter the bloodstream. The American Journal of Public Health reports that unprotected anal sex carries an HIV transmission risk about 18 times higher than unprotected vaginal sex. It can also lead to bacterial infections of the prostate and urinary tract. If you choose to engage in anal activity, the safest approach is to always use condoms and plenty of body-safe lubricant, preferably silicone-based for longer-lasting effect. Avoid oil-based lubricants with latex condoms, as oils can cause the latex to break down. Get regular STI testing, and never move directly from anal to vaginal or oral contact without changing condoms or cleaning thoroughly. This is not just about preventing sexually transmitted infections, but also about avoiding bacterial transfer that can cause serious urinary and reproductive system infections. Your sexual health is a reflection of your overall health. These 5 habits might seem small, but over years they can add up to big problems. The good news is that you have control. Small, consistent changes can protect your sexual performance, your confidence, and your long-term vitality. By making better choices in your daily routine, choosing the right products, moving your body regularly, avoiding prolonged constriction, and practicing safer intimacy, you're not just protecting your sexual function. You're protecting your cardiovascular health, your hormonal balance, and your overall quality of life. If you found this video helpful, make sure you subscribe to The Healthy Body so you never miss another in-depth, research-backed guide to living your healthiest life. I'm Dr. Alex. Thanks for watching, and I'll see you in the next video.